It's going to be a bit of an interactive session. We've got a superb guest speaker today, Melanie LeBlanc from LifeWorks. She's going to be talking about EAPs and why she thinks and I think, and the discussion thinks, among other things, why this is the best value of money that you can spend for your benefits dollar today, and why it's so important. So we're going to be talking about EAPs today, and Melanie LeBlanc is going to be our leader, our illustrious leader today. Next week on the 23rd, we're going to be talking about improving your value proposition with effective communication skills. I'm going to be leading that. I'm excited about that. I'm actually way ahead of schedule on that one. I've already prepared some of the slides. I usually do it, an hour beforehand, but I'm actually ahead because I'm so excited about this. And then another session, the fifth of our sessions is going to be on March the 2nd. And Ben Milletta from Core Online Marketing is going to be talking. That's a must-attend session, and why online marketing in 2022 was so important and what that means. And it's going to be great. He's been spending his life talking about online marketing, so he's a real expert in that field. At the end of the presentation today, you're going to get a survey, a very short survey. It's going to be a survey on how we did today and how we can do things better tomorrow. And also some ideas on what you want to see covered in future Zoomcast series that we do. So you're going to get that survey. Please fill it out. It's only a few questions. Fill it out, send it back to us. We'd really appreciate it. As well as that, Mike Ignatz is going to be sending you a CE credit for participation in today's session, and we want you to participate. We need your cameras on, if possible. Please put your camera on. And you're also going to get a copy of the slides today. Melanie is so graciously offered to share her slides, so we're going to send that out with CE credit as well. And in addition to that, you're going to be signed up for our Trusted Advisor newsletter. So that's if you're not already participating in that, or you don't already receive that, pardon me. If we're doing business together at the Benefits Trust, I want to thank you very much. We're a full service third-party benefit administration company. We work with advisors like you. We do not sell direct, and we've been in business since January 1st, 1994. We provide a budgeted ASO solution, and we love working with you and your clients. So if we're doing business, thank you very much. And we'd love to do more business with you. And if we're not doing business together, we'd love to do business with you. So, please feel free to learn more about us. We're going to reach out to you as well in a number of different ways. But check us out on thebenefitstrust.com, www.thebenefitstrust.com. Melanie LeBlanc is our presenter today. Melanie, give us a wave. There she is.
Hi, everyone.
She's up in the top middle section of my screen. I don't know where she is on yours. Oh, but before we begin, by the way, we were just talking before the session started. Last week, we were doing this, and somebody wasn't wearing pants. And Melanie said, so if everybody's wearing pants, we're already going to be better than next week or this week than last week. So that's it. So pants are required. Please put on your pants. Pants are certainly required. Anyways, Melanie's going to be presenting today. She's going to be talking about EAP programs. Melanie and I have worked together more in the last probably 24 months than we have in the last 5 years combined, just because there's so much discussion about EAP programs. We've launched a number of EAP programs with our clients. Can everybody please mute themselves, or I can mute everybody, I guess. Hold on a second. How do I mute people here? Participants. Hold on a second. There we go. Pardon me. Melanie and I worked together a lot over the last 2 years, more than we have in the last probably 5 years combined, because of what's going on. We're living in this COVID world. It's a great deal of change for most of us, if not all of us. So it's a great deal of change, and with that change comes problems often. So EAP programs are a terrific way to help employees deal with things that they haven't certainly had to deal with. And we're going to talk about that today. But you'll know in a moment how professional Melanie is and how well she knows this space. I think she's a leader in this particular space, and a leader in certainly this industry when it comes to EAP programs. So it's a real treat to have her. But, I was talking to Melanie when we were preparing for this meeting, and I said, Melanie, tell me something I don't know about you, right? And tell me something I don't know. And this is absolutely fascinating. Melanie loves travel. And one of the things that she told me, which is awesome, is she wants to visit, you want to visit as many countries as you can, but it's got to be more than your age. right?
Correct.
More than your age. So I'm not going to tell anybody what your age is, but you were a couple of countries ahead of your age, and then all of a sudden COVID hit. So you're still above the countries above your age, and you visited 44 different countries, I think, so far.
So far.
Yeah, that's it. So if you have any questions about places that you want to travel, just reach out to Melanie offline, and she might be able to give you some insight. Anyways, it's not about me talking, folks. It's about everybody in the room getting smarter. And I'm going to turn this over to Melanie right now. And again, Melanie LeBlanc, hey, thank you for joining us. Let's give her a big thank you for joining us here today. Thank you very much, Melanie. And over to you. Now, don't forget, if you have some questions, please use your hand reactions. You can put up your hand. You can raise your hand just like I did right there. Raise your hand. So let's not interrupt. And then I'll call you out and say, hey, Colin, you've got a question. Fabulous. It's over to you. Or Andrea, hey, you've got a question. Terrific. Raise your hand. And that way we're just not interrupting each other and so on. All right, Melanie, thanks again for joining us. And let's talk about EAP programs and why, it's the best value of your benefit dollar today.
Perfect. Thanks for that. So I'm just going to bring up my screen here and then hopefully still see you guys all on your cameras. So I thought what I would do is provide just a quick overview of who LifeWorks is, so you know who you're talking to and everything like that, and then kind of the key features of EAP. I think people come in, some of us are familiar, we have maybe an outdated version of what we think EAP is. It's always helpful to provide a quick refresher, and then I want to spend kind of the majority of it focusing on the common questions I get about EAP, the value of it, how to promote it, that sort of thing. So really quickly, you'll see that I'm coming from LifeWorks. We were previously known as Morneau Shepell. So a quick history lesson for us. LifeWorks used to be a competitor of Morneau Shepell. We got bought by them in 2018. We've merged the best of both worlds, their clinical expertise, LifeWorks technology and well-being resources to be one big happy family. And then in 2021, so last year, we officially changed our company name to LifeWorks. We're growing every year in a global presence. And I think Morneau Shepell is one of those names that you might be able to pronounce and maybe know how to spell in Canada, but the rest of the world struggles. So LifeWorks a lot easier to remember. So that's who we are. So if you kind of come from that long history in the industry, now you know. A few great facts about us. We are a global EAP provider. We do support in over 180 different countries. So while you might have clients here in Canada, if they have expat populations or looking for support, we're able to help across the world, providing a globally consistent yet locally relevant program. The benefits for us here in Canada is that as we expand and we help different countries, we get different languages. So we're really multicultural here in Canada. We are able to translate in over 180 different languages at intake, and as well as support in 49 and growing number of languages on our platform. So even here in Canada, we benefit from it in terms of having employees be able to engage with EAP in a language that they're most comfortable in. So just a kind of a quick overview, it's always nice to know a little history lesson, and our mission here is improving lives and improving business, both of them obviously very intrinsically linked, and that's what we aim to focus on. So before kind of diving into EAP, what it entails, I think it's really important to talk about a well-being philosophy, because I think this is one of the major shifts we've seen in EAP. It's not just about supporting an individual's emotional or mental health. Of course, EAP needs to be able to do that, but we also need to take a more holistic approach. We need to widen that out and support employees where they fall in that continuum of care, how and when they need support. So what I mean by that is if we look at an employee's physical, financial, social, and mental well-being, those 4 pillars, I might come up with an issue in one of those areas that I need support. It might be a social issue. I could be struggling with relationship issues. I could feel isolated being at home, not having the same support network. It's not quite a mental health issue yet left to my own devices without any support in that area where I am right now, it can escalate. So when we expand the level of support we provide and we help employees on all 4 pillars, we're able to be more proactive, and we're also able to reach a wider audience instead of waiting for those individuals to escalate and become a larger problem. And I think it's also, I said it before, I said it very quickly, but it's also when and how individuals want support. Some people want to speak to somebody, have that 1 hour counseling appointment that works for them. Others say, you know what, that doesn't work for me. I'm a busy person. I've got 10 minutes in the morning or 20 minutes before bed. That's what I have to allocate. I need something that suits me. I don't want to see somebody in 3 days. I need help right now. What are the supports available? So you'll hear that too, when you look at the products and the services coming out in that EAP world, you'll see that it really has expanded, focusing on those common 4 themes: mental, physical, social, and financial health. So that's what we kind of aim to do here at LifeWorks. Now, when we, kind of key features of an EAP, some of you, this might be just a quick refresher, but I think it's always helpful to note. EAP needs to be 24/7, 365 days a year. You never know when you need support, and so we are always operational, whether that means that you're calling us, visiting us online, chatting with us, downloading our mobile app, anything like that. Especially in the pandemic, our chat services have really increased in intake. We operate 24/7 for chat services. Some people don't have the ability to take a private call from home, and so being able to message us is really crucial. EAP, Employee Assistance Program, that's kind of what I've been calling it. Some of you might say EFAP, Employee Family Assistance Program. Both are right, just different acronyms. As a reminder, it is designed also for family members, so spouses, common law partners, and dependent children. I bring this up because while it's the employer paying for a benefit for their employees, we inevitably know that if an issue is happening at home, if my child is impacted by something, if my spouse is struggling with something, I'm going to be distracted. I'm going to be concerned about that. If I can get them help, and if my employer can help me take care of my family, I feel more engaged. I'm more present with what I have going on. So it's really important, of course, to also find programs that promote access to the family members and make it really easy for them to engage as well. We talked a little bit about those translation services. So again, everything is fully bilingual here in Canada with those translation services, and we provide the same level of care and support across the country. So having one of the largest counseling networks, not just in Canada, but in the world, really allows us to provide a great deal of coverage across the country. When we look at EAP, so kind of the key fundamentals of what I think any good EAP should have, the first and foremost, again, is that 24/7, 365-day support, and that it extends to crisis counseling. So, if you have an individual who is in crisis, at risk, in distress, highly emotional, and they need support, they should turn to their EAP. That should always be an option available to them, and it should be very easy for them to get in and engage with the supports available. One big thing that we have noticed since the pandemic is what we call just-in-time support. And so these are individuals who need support right away. Just in time, they're calling in right away when they need that support. And it doesn't necessarily mean that they're in crisis or they're at risk. What it means is that they finally decided to make that call to action. They finally decided to call in and speak to somebody, but they've made sure that they have time now. They have that 30 minutes now or that hour now to speak to somebody. And so we've seen a really high increase in that. And so that's why we are rapidly trying to increase our counseling networks, adding more staff to our call centers to really meet those needs. And so that's something to also keep in mind is people, I think, every single year we become maybe more and more impatient as a population, but it also means that we're looking for convenience and things that work for us. And that's a key part of EAP. We also, of course, provide short-term counseling. Now, for us, I think providing a wide array of modalities is really important. So that in-person, face-to-face counseling is a cornerstone to what we provide, assuming numbers and everything cooperate. But then there's also video and telephonic counseling, online chat counseling, and virtual group counseling. So having kind of a menu to choose from that can work for individuals' learning or lifestyle is really helpful. Some people find video counseling helpful. We've had lower amounts of no-shows or last-minute cancellations because you don't have to worry about traffic or, having to rush from meetings that have run late. You're already at home and it's easier to make your way to your appointment. Others just really need to get out of the house and they need to see somebody in person. So having those options available, really important. Above and beyond that, we also have our work-life consultations. So these are professional services to help you manage everyday stresses of life. You're not going through an issue where you need to see a counselor necessarily, but some sort of life event where you can benefit from professional advice. So these are things like career coaching, so resiliency and burnout. How do you work with that in the workplace? Legal and financial consultations. Legal ones have always been the most popular. Nutrition consults, which have exponentially grown in popularity since the pandemic, as well as access to parenting and elder care specialists. So those are kind of the components that make up our work-life consultations. And then I think above and beyond those services, which are designed for employees and their family members, anybody can utilize and benefit from those services. I think having support specifically for people leaders is really important now more than ever. So we do provide management consultations. So our specialist team that have backgrounds in organizational behavior to help support people leaders. And, as an individual, they're going through the exact same thing. They're living the pandemic, they're struggling with it. But above and beyond that, they're tasked with supporting their teams, being the go-to person for their employees who are having a hard time. Kind of going the opposite direction, they're also the people where it flows through them to deliver difficult conversations and difficult topics and changes. And that's really stressful on a people leader. And so we see higher levels of stress reported in them. We see higher turnover with managers because it's just a more difficult job. So we need to make sure that we have tailored supports that can help them with what they do. They're not a counselor. They're not a trained, well, most of them probably are not a trained professional as a counselor. And so they need to find resources that can help them so they know how to direct their employees to the right resources so they're not playing that role all the time. Another really great piece is on-site trauma support. So as much as we would rather these things not happen, these critical incidents of things like a sudden death of an employee, a workplace accident, a natural disaster, or an act of terror, all these kind of horrible things that we hope don't happen, inevitably we need to be prepared for them. So we are able to deploy counselors on site to debrief employees and diffuse the situation. I think that this is really crucial. And I also think that as an advisor, this is oftentimes when EAP is coming up. They might not have an EAP in place, and then all of a sudden, wham, bam, they wake up one morning, something traumatic has happened, they don't have the supports in place, and they turn to you, somebody that they trust, they know how you work, the connections you have, and the relationship you have with their company, looking for support. So we do provide on-site trauma support on a fee-for-service basis, whether you're a client or not. That's always helpful to remember, but that's oftentimes a foot in the door to talk about EAP. While I wish it didn't have to happen because a crisis has occurred, it is really helpful to know that that's a support available within EAP or also kind of held separately. And then last but not least, and I think the area that has changed the most is a well-being platform. So something that's a little bit more personal, a little bit more proactive, where somebody can download a mobile app or access us through a web browser and utilize the services on their own time. So our well-being platform has a library of EAP content, so thousands of clinically vetted articles, podcasts, toolkits, that sort of thing, but also additional services. So a partnership with a virtual fitness provider to work on somebody's physical health, a perks program to help with somebody's financial well-being, health assessments to measure all 4 pillars, a news feed to build that social connection at work. It really encompasses a lot of different things within our essential offering or, again, enhanced programs. I think when we have an app that's just typically where people engage with first, it's where we look at our phone so many times a day, we're well connected to it. And so if we're built more into their everyday life for employees, it's easier to remember where to go to. So coming back to that just-in-time support or that crisis need, if they're engaging with us for different reasons, whether it's working out or perks or company posts, they know where to go to. They already are familiar with the name. It's very easy for them to find that information. So that's kind of a high level of like when you're looking at EAPs, the buckets they should tick. This to me is what really rounds out a full program. I think, of course, everybody thinks about that counseling and that crisis support. It is the foundation. But if we always wait for things to become a crisis, we're waiting too long. And then we can help people before they get to that point. We can also help people who aren't in crisis. I think that, some people are looking to maintain gains or work towards different goals, and that crisis support doesn't always help them because they're not in crisis. So how can we engage with them sooner and not just wait to be more reactionary? So before pausing, maybe to have a little bit of a conversation, the last thing I wanted to talk about before we got to questions is some additional supports. So these kind of sit outside of a traditional EAP, but can be added onto the program to support individuals and companies with their wellness initiatives. And I say this because this is an area that is rapidly growing in interest, whether it's internet-based cognitive behavioral therapy sessions, so something that's maybe a little bit more clinically intensive, allows you to be therapist guided through a session, or the flip side of looking at virtual healthcare as we maybe get ready to go back into the offices, all these changes with vaccine passports, this, that, or the other. It can be really stressful for individuals, and it's hard to get access to great medical care and advice for some. Having that built into your EAP program, or even extended mental health support. So things like substance abuse programs and structured relapse prevention programs. I think we all know that addiction's on the rise, that people have had a really hard time at home, and that has resulted in people drinking more, smoking more, kind of comorbidities, if you would, and a lot of employers are looking to help employees to identify. And so offering different buckets of support that you can add in if and when you need it, it's really helpful. So instead of having multiple solutions and providers to go to, it's nice to know it can be housed all in one. So that's kind of a really high level overview of what we provide. Like I said, the kind of next part of my presentation or conversation I'd like to think of is kind of talking about some common questions I get. But before I take over that, I'm happy to maybe pause, Rob, and see if there are questions or maybe things that you want to add before I continue.
Thank you very much, Melanie. This has been terrific so far, and I'm looking forward to the second part of this. But Andrea Ballot, put your screen on and come on back. You've got a question that I think is an excellent question, and maybe you can, I know you put it in the chat room, maybe you can expand on it a touch, and I think that would benefit everybody. Andrea?
Thanks, absolutely. So the question is, I'm interested to know if there are any statistics with respect to online self-serve options that are available to the employees, and if they are using those services. And I was also wondering if there are any stats to indicate if having an EAP reduces sick leave and disability claims.
So that's a great, well, both of them are great questions. So in terms of online platform utilization, we, for direct clients do provide it. We do see a lot of uptake with our online platform, but I would say that utilization can vary based on workplace culture, industry, that sort of thing. So I find when you look at companies that are, in front of their computers, pretty tech savvy, professional services, and they have a very strategic wellness plan, we see the online platform really well utilized. So high enrollment at the very beginning and continuous utilization as well. For others industries where it comes down to things like manufacturing, retail, that sort of thing, utilization will be lower, but it is still something that individuals are engaging in, but I think it takes sometimes a little bit more effort on the employer side to increase that awareness and letting them know what's available. I think in those cases too, really promoting the mobile app is helpful. So we do see a lot of engagement with the platform. Especially with a program called Care Now. And so I don't know how many people are familiar with Care Now for LifeWorks, but this is our virtual set of kind of self-directed programs. All of these programs have been designed by clinicians building in kind of cognitive behavioral therapy principles, but they're self-directed. So I can maybe choose to go through a stress module on my own. And, there's 18 chapters that I can work through at my own time and my own pace. We started this program with 3 topics in 2019, stress, anxiety, and depression. And we received an overwhelming response, and it's continued to climb throughout COVID. Again, with people not wanting to go out, maybe not having time or privacy for a full hour conversation, Care Now has really increased. So at the end of last year, we had 12 modules. We've just released another 3, again, kind of taking into account what's kind of most common and most requested. And we have another 12 slated to launch for the rest of this year. So I think too, depending on the areas of the programs, we're seeing a lot more engagement in specific areas. In terms of your other question, much harder to answer. there is data on ROI. There is data around how EAP can impact workplace productivity, lost time, absence, and everything. It can be hard to kind of link whether it's just EAP versus other initiatives. It is one of my answers to a question coming up about the value of EAP. There's a really great report out there called the Workplace Outcomes Report, and it measures the impact of EAP on workplace productivity and lost time. So there is a really high correlation. The one thing I would say is that those reports, though, are done with really large companies. Because they have more people, it's easier to measure the data. You still see an ROI that's fantastic in my mind when it comes to smaller organizations, but you just inevitably don't have enough data to truly draw that link between having an EAP in place resulted in less leaves or having an EAP resulted in shorter leaves. That data is there when you look at larger organizations, but I think a lot of us look to talk to smaller clients about it. You know, Bell Canada as a test study doesn't quite correlate maybe to the same way as a startup that's right now 5 employees.
Sorry, could you repeat the name of that report again?
It's our Workplace Outcomes Suite. So I can certainly share more information with you, Rob. Maybe I can send that to you in case
Offline.
you want to link it with the presentation. We have our 2020 report that was published earlier in 2021 with our next year's report. So 2021 report should hopefully be published in the next couple of months.
Perfect. If you can send that link to me, that I'll take care. Thank you very much, Melanie.
Yeah.
You know, it's interesting. You're talking about, or you were talking about, sorry, Andrew, that satisfactory answer your question?
Absolutely. I have one other question as well. And I know, Melanie, you and I have talked many times about this, is one of the key issues that is a frustration with our clients is when they have an EAP plan, the utilization is so low. And aside from forwarding the monthly newsletters that they receive from LifeWorks, there's not a lot more that they can do other than trying to promote the program. And I think that they do look at the cost factor versus the utilization. If LifeWorks has any additional, or if you personally, Melanie, have any additional suggestions, we're always happy to forward that along to our clients as well.
Yeah, so I think, I mean, more comment than question, but I think that a lot of companies launch an EAP and they kind of think it'll be self-propelling, where it's not a one and done. Like I launched it, I ticked the box. It does require that constant promotion and that increased visibility. I think there's certain things, you know, cultures that aim to remove barriers that lean into having those mental health conversations and really highlight those, you know, Bell Let's Talk Day, Mental Health Week in May, International Mental Health Day in October, kind of really focusing on those events, leaning into those conversations to reduce stigma. All of those help, but they do take time. I think that also building in EAP into your other wellness initiatives can go a long way. So, you know, some organizations will have like Financial Awareness Month and retirement planning, and it can be focused on those solutions that they have, but reminding them that they've got a financial consult through EAP. So tying in some of those initiatives, I find, you know, when it gets a little bit more ingrained in the culture, and that helps a lot. But it is definitely, I think, a challenge. I think too, especially when we think of smaller organizations, they're not a robust HR team of 20. Sometimes it's one person playing payroll, benefits, everything. And so trying to make it as streamlined as possible. So, you know, we do things like monthly orientation sessions where we go through and talk about the program and share the resources. So the program administrator doesn't have to do that for them, but they do have to promote those sessions and get people to sign up and join.
You know, it's another way to measure ROI. You know, ROI is return on investment versus the premium paid, and you know, what's the investment? You know, how many people use counseling versus, you know, what did we pay for that, right? You know, hey, geez, is that the proper way to measure ROI? Another way to look at it is, I think, from an employee retention standpoint, from an employee attraction standpoint, which is really critical right now. You know, a company is listing their employee benefit program, and instead of just listing, you know, we've got group life insurance and group AD&D insurance and group LTD insurance and, you know, health and dental, and we've got an EAP program. It's, hey, we've got group life insurance CI, et cetera, but we also have virtual healthcare. We also have dedicated counseling. We also have, all of these types of things. So you're making the list considerably longer, and it's extraordinarily comprehensive. You're providing a very comprehensive benefit plan. Whether they use it or not, that's a different story, but it's a very comprehensive benefit plan. One real quick question here, Melanie, is Romano. Where are you, Romano? There you are. You want to ask the question?
Yeah, I just, a lot of employees are very hesitant to get into these EAP plans, whoever they're provided by. But we all know that it's confidential, but they often wonder, well, how long is this really good for before, I get pushed off to a local counselor, or do I have to pay? And if I have to pay, how much is it? Can I afford it? And meanwhile, we've got the crisis at hand that needs to be solved. How do we go past that?
Yeah, so for us, EAP is designed to address and resolve short-term issues. At LifeWorks, the most kind of common model, it depends again, depending on carrier provider exactly, but is to provide a clinically appropriate model, meaning we evaluate each individual to determine what is clinically necessary to address and resolve their issue. So maybe it's 1 or 2 sessions, they're just going through something temporary, they need to be heard, they need to be validated in what they're feeling, and a few coping mechanisms, and off they go. Another individual, maybe it's something a little bit more complicated or complex, and they need 6 sessions. Both are short-term in nature and will provide what's necessary to resolve that issue. Now, not everybody obviously is fortunate enough to just have a short-term issue. Some people might be faced with a long-term problem where they need more of that ongoing continuous support. And so EAP, I always say, is going to be a piece of that puzzle as opposed to the entire solution. First and foremost, we will always be there for crisis support. We don't distinguish between short-term or long-term care. If somebody's calling in and they need to speak to somebody right there in that moment, we will provide them with that crisis support to de-escalate that situation. And if need be, also provide bridge counseling until they can get to the appropriate long-term resources. And so we'll help, refer them to community programs, let them know where they can find counselors. At the end of the day, it is up to them to find a counselor that works for them and to coordinate with their benefits if it's going to fall outside of the EAP. So they can tell us, I don't have social workers included, but psychologists are okay. So we can show them where they can go to find a psychologist and coordinate that benefit. And then, other resources out there that will work on a kind of a pay scale of what is affordable. So I would say that most individuals, when it comes to short term, they don't have to worry about being referred out because the program is designed to address and resolve that issue. For the long-term ones, then it's really about connecting them to the right supports. One other kind of additional fact I would say is that we operate on a per issue basis. So there's no kind of cap to the number of times you can call LifeWorks. I think sometimes life has this horrible way of when it rains, it pours. We have one incident happen, a few months later, something else happens, and we kind of go on from there. So an individual will get reassessed per issue. If they had, an incident come up in February, we'll give them the right case number of sessions for that case. If something comes up again in May, something different, we'll reevaluate and provide the right sessions for that specific issue. You're not limited to say, oh, you've used LifeWorks once this year, please wait again until next year to get your next 6 sessions. That's not how we operate.
Melanie, it's kind of like a country and western song. You lose your dog, you lose your house, you lose your wife, you lose your pickup truck. It's kind of like one of those things. Hey, tell us about some of the questions you get asked.
Yeah, absolutely. So I'm not a journalist, but I feel like these are always the questions that I get asked: the who, what, why, how, when, and where. So to start off with, who is EAP good for? I think from a company's perspective, EAP is designed to support all different types of organizations. The vast majority actually already have some sort of EAP in place, whether it's embedded or not, whether you're utilizing it or not. But it's already really ingrained into the workplace, but it's finding the right EAP for them. I think we also need to think or move away from the thought that EAP is for large organizations. LifeWorks doesn't have a size minimum, so we help groups, from 5 to 10 lives to some of the largest employers in Canada. We help across the spectrum. It's also fair to say that we need to support all different industries. So even, we're seeing a huge increase in retail, an area where Previously, we probably didn't see as much engagement with EAP, but with the stresses that they face in terms of opening up and shutting down and maybe angry customers and everything like that, providing supports in that industry. So EAP is for any size organization anywhere in the country and for any industry. The other thing too, it's, I think, broadening to be more than just a North American or Western type of benefit. A lot of employers who are maybe Canadian or even US based are now looking to extend and make it a global offering. Doesn't matter where an employee is located in the world, they still have the same problems, they still struggle with the same issues. So we need to provide similar supports across the country. So this is one that I get asked a lot, is there a minimum? Is it really good for just one? No. The other thing that I would also say, or that I get asked a fair bit, is kind of who is EAP good for in terms of employees? Some people think that EAP is just part of the benefits package of whoever gets group benefits gets EAP. That doesn't have to be the case. We're seeing a lot more employers, because in comparison to maybe some other benefits, EAP is relatively inexpensive to implement, that they expand to include more people in the EAP offering. So they might opt to include it for part-timers. Rob, you said it about retention or even attracting talent. It's relatively inexpensive to give it to part-timers, to give it to contractors that you're looking to keep for a project. You don't have to think about it. Only those who get group benefits get EAP. You can extend it to a lot more people as well. So that's kind of, whether you're looking at it for the company or for the specific individual, it really ranges with that. And the other question too is, what should clients look for in an EAP? Now, I know I've kind of gone through the fundamentals already of, short-term counseling, work-life consultations, supports specifically for people leaders, those are essential. But above and beyond that, we also need to look for EAPs that provide support across the continuum of care. So helping employees, again, regardless of where they fall, giving them support how and when they want it. And so what that means is providing supports that remove barriers for access, having an online platform that they can engage with, but also not going so far the other way of just virtual supports. I think that there's still a lot of people who benefit from that in-person counseling model, who still really crave getting out of their house and seeing somebody in that face-to-face interaction. So, if we create something that's more diverse, something a little bit more robust, we inevitably are more inclusive. We're able to help more people. And I think that that's what we need to look for in an EAP. In short, every journey for an individual is different, specific to that. So we need to have an EAP that's able to accommodate all of those differences to be more inclusive. That's taking into account their lifestyle or their learning style, their individual preferences. Something that we're getting asked so much more now is about our counseling network, and can I make a specific request? Excuse me. Whether I'm looking for a male or female counselor, an ally in the LGBTQ community, somebody who can relate to me based on race, age, gender, religion, we have very specific requests. So I think what I always encourage people to look at with an EAP is something that is robust. If you look for a program that just ticks the box to say I have EAP in place, you kind of get what you put into it. When you have a robust solution, something that can expand and support a lot more individuals, you inevitably get more return. You're inevitably going to engage with a larger population. And I think that that's why you're seeing, EAP in general, not just LifeWorks, expand in this space to incorporate more than just counseling, more than just crisis, more than just, X, Y, or Z, because that previously only had that 5 to 10% engagement, but we know that there's so many more people who need that support beyond just that 5 or 10. This one probably an obvious answer to a very important question, but why is EAP important now more than ever? People are one of the largest costs that a company has, the largest investment that they make. So we need to make sure that we're smart about it. We know that individuals report higher mental health scores, so kind of better mental health, when they feel supported by their employers, when they have programs in place. And that has an impact on lower absenteeism, more productivity. And that's why EAP is a really crucial impact. on top of that, obviously the pandemic is going to have long-lasting impacts to mental health. We're already seeing it, it's here, but it's going to be here for a very long time. The sustained trauma is going to have a very large impact, and we need to be prepared for it. So I know I kind of quickly mentioned the workplace outcome suite, and we'll kind of come back to some of that information, but another really great resource for you to tap into is our mental health index. So every single month, LifeWorks actually surveys thousands of employed adults in Canada, the US, Australia, and the UK to measure their mental health score over time. And so every month we can see how that changes and what's happening and what's trending. So we know that 33% of Canadians are reporting higher job stress in 2021 than they did in 2020. We know that 1 in 5 resigned from their jobs due to increased stress and due to mental illness and strain at work. So that's where we can see these numbers. We already know what's happening. I mean, you don't necessarily sometimes need a report to tell you all of this, but I think it is really important to kind of have an idea of the numbers, because you can kind of get in front of it. It helps you shape those conversations with clients, because they're going to inevitably relate to some of those aspects. We're seeing, retention problems happen, and we need to get in front of them. And then I also even mentioned too that just-in-time support. I think sometimes organizations, they wait until something happens, an employee is identified as having an issue, and then they react to find them support. Then they go and say, okay, how can we help this individual? Whereas you're letting that fester a little too long. When you have EAP, it's a lot more proactive. They can engage really, really quickly. And I think that that's crucial when it comes to why it's important now. This one we talked about a little bit. It goes to, Andrew, your questions of how do you get the most value out of your EAP? While it is relatively inexpensive in comparison to others to implement, it's still $1 spent and $1 that you need to account for, and it has to be justified. So I think that there are certain things, again, to reiterate, removing barriers for access, making sure it's easier for people to get support, know where to go to, having those conversations that help reduce stigma. I think, people leaders and, executives, presidents of organizations, if they can start having those conversations, it opens up a dialogue. Tying into those initiatives are really crucial. And then the other piece too is that reporting and analytics. There's a quote, and I feel like I say it all the time because it just resonates, is often we don't count what we can't measure, and we don't measure what truly counts. And I think that that just kind of speaks to the fact that we need data. Sometimes, with smaller organizations, it's hard because of confidentiality, but that's when we turn to mental health index or the workplace outcome suite and more aggregate information, because even on a smaller scale, it's going to be impacting us. So relying on those reports and metrics to really make informed decisions is really important. And then I wrote down some of these notes because I knew I wasn't going to have be able to remember all of it, but with the ROI for EAP, we'll share that workplace outcome suite. But a few things that we found is that we typically saw an ROI of $5.69 for every $1 spent. So that takes into account lost productivity, absenteeism, leave, that sort of thing. So for every $1 spent in EAP, we tend to see a $5.69 ROI. That spans all sizes of organizations. When we look at the cost of counseling, a typical EAP case costs somewhere between $2,000 and $3,500, with an hourly counseling rate sometimes averaging around $160 per hour. So when you think of it based on that number, you need literally only 1 in 100 employees to use the program for you to break even. And so to me, I think that that's really crazy, because we know that it's more than 1 in 100 people who need support and who are probably going to engage. And it's not necessarily difficult to get that 1 in 100 to reach out. So that the ROI is there. There is tremendous value, but I think you need to nurture the program. You need to make it more visible. You need to incorporate it into your conversations, increase that visibility, and make it a lot easier to access. And then you'll get some of that value out of it. And then when should clients consider providing EAP supports to employees? I mentioned it more before about organizations waiting until there's a crisis to occur and then reacting. Something has happened. I now need to look at supports. What do I have? And you kind of scramble and then you put something together. I mean, I think you should always respond and make sure you're helping employees in times of crisis, but I think we also do a disservice when we just wait until there is a crisis. I don't think it's ever too early to bring up EAP or to implement it in the workplace. I had a conversation last week about with a new business owner. She just launched her own company. She had EAP at a former organization. She loved it, and she wanted to attract talent, and she wanted to make sure that as they're, maybe getting, maybe struggling onboarding, they're stressful for with their new job, she wanted it implemented right away. So she was a company of 3 employees right now, but she wanted to grow and she wanted to build EAP into that growth. And I think that that's amazing because it's already right there in the culture, ready to go. So making EAP more proactive allows us to engage with more employees. And I think that that is really important. So instead of being reactive, maybe being a little bit more holistic in how we approach an employee's well-being. So that's when I would do it. I would do it as soon as possible, talking about it. I'm sure you guys also have conversations with your clients in terms of, benefits, increased costs, claims, leave absences, and it's a good part to tie into it as well and having those conversations. And then that leads me to the last one in terms of where can I find more information. So Rob, I know you shared it before, but you can always go to the Benefits Trust. They're a great resource, or check out the LifeWorks website if you want it. Our mental health index every month is published on our corporate website. We will be sharing a copy of this presentation. I'll also make sure to link out our workplace outcome suite for some of that ROI information. But above and beyond that, Rob and I have had many conversations over the last couple of years, whether it's me joining on client presentations or even just catching up in terms of what I'm hearing and how we can support. So whether you want to reach out and set up a phone call just to talk about your clients and how we can bring up EAP, or maybe you have a presentation or a meeting scheduled and saying, I really want to bring it up. Can you help me? Whether it's sharing slides or joining you on that presentation, we are a wealth of information and resource that you can tap into, and here to support you with that.
One thing that Melanie mentioned right there is, that ongoing support. I've been on a number of different calls with Melanie and with advisors and with clients, and Melanie, as you can tell, is absolutely superb at this. She's also done member meetings or employee meetings, and it's just such a pleasure to watch. So thank you for that, Melanie.
Oh, thank you.
We've got about 10 minutes left. Gil, you had a question, Gil McGowan?
Yeah, Robert. Melanie, I'm trying to understand how deep LifeWorks gets into claim management. I mean, the EAP, I've used LifeWorks EAP with a personal family member, and it was awesome, but there came a point where you kind of wonder, where does LifeWorks walk away, and then the disability management department of a life co would take over. And then the second part of the question was, is there any integration of drug management or potentially utilization of pharmacogenetics in helping people who may be having mental stress and taking drugs? Do you interact with the employees in that way at all?
So a very complex question, and one honestly that I don't get asked that much. So EAP, because it's really designed to be short-term in nature, it tends to be the thing that you try and bring in before an employee goes on leave or makes kind of that claim. It's designed to help them avoid taking time off. It doesn't typically kind of work when an individual is on a longer term leave or a stress leave and making a claim and you're trying to find ways to bring them back. It's not to say it's not successful all the time, but it is a little bit more difficult. We do have, kind of under that additional support side, we have extensive counseling. So we have things called like workplace referral programs or depression care. And these sit outside of the EAP, but are really designed to help in those situations. So they're more clinically robust in helping the individual. Again, we partner with claims teams, and we can provide reporting back to the employer, suggestions on helping them return to the workplace and kind of modifying it that way. So I think kind of EAP is short-term, hoping to avoid them going off on leave or having to make a claim. Once they are already there, it tends to require more robust support, which we can still support with through those kind of workplace referral programs, substance abuse programs, sometimes trauma or depression care. And then above and beyond that, your kind of questions about pharmacogenetics. Our absence and disability team that does manage it, they have technology, they have supports that kind of fall more in that bucket. So LifeWorks as an organization, yes, absolutely, we have supports, and we can certainly connect you to the right individuals if you're looking to learn more about that. But those supports do sit outside of EAP, especially because EAP is not designed to be a diagnostic tool. We're here to support an individual who might have anxiety, who might have stress, who might have depression, but we're not here to make a formal diagnosis or, work with kind of medication or that sort of thing. A counselor can make the suggestion to say, based on what you're going through, you might want to talk to your doctor and go that way, but not necessarily do that deep dive of pharmacogenetic testing and that sort of thing.
Okay, thanks. That was great.
Melanie, we've got,
Robert.
thank you. We've got about 8 minutes left, 9 minutes left, but tell me, what's the best way for us as advisors to start the conversation with a client that doesn't even know how to spell EAP, right? How do we start the conversation? And then what materials do you have that you can that we can leave behind or send to our clients? And then what happens when the client says, hey, fabulous idea, thanks for bringing this to us, how do we implement it?
Yeah, so I think that a lot of times it's asking them about their pain points and what they're having with their employees, because I would be shocked if you could point me to an organization that doesn't have one employee who's struggling or is having difficulty with their mental health. I think by just asking their questions of, what are your employees struggling with right now? What are you currently doing to support? What more do you think could help you in your role? I think oftentimes when I don't mean it in a bad way, but when we make EAP sound like it's a tool to make an advisor or a client's job easier, it's often an easier conversation to have. But first kind of asking where they are struggling and then what they're doing to fix it. Because oftentimes they know that they're struggling, and it's kind of like you're in a sinking boat with, holes in it. You're just trying to plug them as opposed to being really strategic with it. So I would start by just asking where they are struggling and what they are doing. And then based on that, and sometimes too, it's in that conversation when you're looking at other reports and benefits information, kind of you can see that trend already popping up. And then talking to them about EAP, knowing that support is really easy to implement, and it's something that can bring tremendous value for relatively low spend. We, of course, have brochures that we can share to kind of just bring it up and go from there. But I find, program administrators or HR, they have an idea of EAP. They're in that space, they know it, but they often don't know everything that it's entailed. So just starting that conversation is great, but then saying, you know what, I can't do it justice. Exactly. There's so much more out there than maybe the last time. Why don't I set up a meeting? Why don't we kind of walk you through what's available? And then having that call, bringing someone like me, doesn't always have to be me, but someone like me to shine and show you, and kind of support you to say, like, this is the partnership that you have, and here's everything that can be made available.
Just to interrupt you real quick, folks, Melanie will make you look good in front of your clients.
Thank you. And then in terms of kind of implementing, EAP is also really quick to implement. Again, depending on how quickly a client can sign a contract or sign up, but we need typically 2 to 3 weeks to get everything launched and ready to go. So, even if you have clients coming to you in that crisis mode, it can be turned around very, very quickly, as opposed to, something that needs to be longer to implement. And I think, above and beyond that proactive ways, I mentioned 3 awareness days throughout the year. So Bell Let's Talk Day just passed, or even Blue Monday in February. Those are kind of very big mental health days. But Mental Health Week in May, it's a great time to lead into those conversations with your clients, or International Mental Health Day in October. So again, when you're just looking to do a quick check-in, you can use those kind of awareness days to start that conversation.
Awesome. There was some other, or who else has another question? Any other questions? Any other thoughts? Just jump right in or raise your hand. What is this, Andrea? Oh, there was one question. Sorry, Diane had a question that I don't think we got to. Diane Dumont. Diane, you still here? No, but her question is, does this short-term approach really resolve the issue? And is it, I'm sorry, I'm having difficulty reading my screen because it's so small. and it is.
Can you guys hear me now?
Oh, there you are, Diane.
There you
Yeah,
are.
sorry, wrong mic.
Diane.
Yeah, well, I was actually interested in, well, we did speak about statistics earlier, that it was difficult, and that was kind of where I was leaning into, is that we're talking about short-term issues and resolving them, but from my experience, I've seen a lot of short-term issues that are quickly resolved and like kind of put under the carpet, and the underlying issue isn't necessarily dealt with, and it keeps coming back and coming back and coming back under different portraits, and then the person ends up on long-term or short-term disability for a really important mental health issue. So often my questions when I'm dealing with clients is that, yeah, EAP is going to resolve the quick issue, like we mentioned, and that's the objective of it. But shouldn't we have a step further in getting, an appropriate long-term approach to what's going on? So just wanted maybe your personal reflection on how you see that, or how that goes in your mind.
So in an ideal world, the answer is yes. I think you should have short-term supports as well as long-term supports, but long-term supports are very costly. And so that's where you have it come into your benefit claims in terms of, psychologists or psychiatrists or social work claims, because it is so expensive. EAP is great, and I'm obviously extremely biased towards why it's wonderful, but it is a short-term solution. It is designed for those not smaller issues. They're still very important, but not necessarily for those ones where there might be an underlying issue or things that are compounding or reoccurring that need that more extensive support. We do, like I mentioned with my previous answer, like have more clinical, robust supports that are there. I think that that's also why we're seeing those internet-based cognitive behavioral therapy programs come into play more. They're longer, they're more like that 10 sessions, therapist guided, checked in, that can support a little bit more above and beyond EAP. So EAP will never be the answer to everything, and you definitely are going to need supports that are more long-term, that can help different individuals. It just, unfortunately, most organizations don't have the budget for that. So, it's something that you have to start somewhere. So often EAP is a little bit more cost effective, and they bring it in there. And then you also have that relationship. So for those individuals that do get identified to say their needs are more, they need something extra, this isn't working, you already have that partnership with a vendor that you trust to be able to guide you in the right directions for those supports. I think so many employers are well-intentioned and want to do the best that they can with their employees, but there's still a finite amount of budget in what they can do. So I know it's not a great answer, but that's kind of where I find it. I'd say probably maybe 80 to 85% of people calling in short-term resolved, it works for them, but you still have that other 15% that need something more, and that's kind of where you need to look beyond EAP.
Thanks, Melanie. If you could stop sharing your screen, we're just running out of time here. We've got
absolutely.
a minute left, because I want everybody to take this opportunity. We had 76 people on the call today, which is awesome, but Melanie, you are a superb presenter. Everybody in the room got smarter. It's as simple as that. Everybody in the room got smarter. Even if you're a seasoned pro like Andrea is and does a lot with EAP programs, but everybody in the room certainly got smarter. So Melanie, thank you very much. Let's everybody give her a clap and a big shout out.
Thank you.
Use Melanie as a resource when you're talking to your clients about EAP programs. I think she's the best in the industry. That's my personal opinion. LifeWorks, I think, is the most comprehensive service that's available in the marketplace, and the best value for certainly the money that your clients are going to spend on EAP programs. We've run out of time. We want to, on behalf of all of us at the Benefits Trust, we're a full service third-party administration company. We work with professionals like Melanie. We can link this on to any benefit plan that you have with us, certainly. And if you're not doing business with us, we'd love to do business with you. So thank you very much. You're going to